snowmobile to render aid to a critically ill patient. The rescue squad couldn't make it, but Marge did. To demanding TB skin tests for a Russian delegation visiting our schools. Were they infectious, and why hadn't they been tested before they arrived in Ashland County? To organizing a shot mobile, which was the sheriff's SWAT team van specially painted just for Marge, used to give tetanus and pneumonia vaccine during Ashland County Senior Citizens Day at the fair. Marge has never lacked enthusiasm in her quest for better public health for our community. Her patients did and still do come before her own well-being. Her career in public health began 25 years ago at the Ashland County City Health Department, where she was a school nurse, a clinic nurse, a home health nurse, and whatever else nurses are supposed to do in public health departments. She came up through the ranks to assistant director, and in 1981 was appointed our director of nursing. Throughout this time, she has given 100% of her energy to the pursuit of high standards in the area of public health, both at work and within several of the civic organizations that she belongs to. She has, and she still does, serves on a variety of local and state committees and advisory boards, whereby she's carried public health policy above and beyond our small community. Those who have served with her during her 22 years as a member of OPHA are well aware of her enthusiasm and expertise of public health awareness. She is a walking public health encyclopedia. I have yet in 11 and a half years to ask her a question she couldn't answer or give me a new insight on a particular medical or nursing problem. She has gone beyond the obvious to remedy a problem. She assesses persons and situations with that really astute public health eye. Marge was personally instrumental in developing a bloodborne pathogen policy for our county and city employees 2 years before OSHA regulated it, and she constantly recommends HPV vaccine for our county and city employees. She also pushed for an emergency operations plan in response to any disaster in Ashland County. And you know, she even took on the military. When our 1486 transportation unit came back from Saudi Desert Storm, and this unit would be in our county for just 2 days a month, she organized and TB skin tested for 139 of the 193 soldiers who might be exposed to TB when they were in Saudi and now might expose our county residents. And in follow-up to that, she kept in touch with 20 other city county health departments so that they could follow up on test results. With her knowledge and expertise, she is always talking to schools, organizations, and peers on communicable disease, bloodborne pathogens, TB, HIV/AIDS, and emerging pathogens. She not only staffs her office with professionals, but she often works the clinic herself just to make sure she's in touch with the public. Her multitude of stories make one laugh and cry, and I wish I could tell stories like Marge does. She's never at a loss for stories, but maybe I'll let her tell some of those to you herself sometime. Was anybody worn out yet? Well, you know, Marge wouldn't be. She keeps going strong with fresh ideas when we're ready to just shut down. One of her peers said she would make a valiant nervous. I won't tell you who that was. And another said she has energy to burn, and she burns it out right in front of you. Whenever the phone rings, it usually means a new challenge for Marge, whether it's an STD, a TB skin test, or headlights. Every health department needs a visionary. You need those to carry out the vision, but you need the person to think ahead with vision and perspective. The list of her contributions to public health goes on and on. Suffice to say that she is the visionary for our health department and for healthy people in a healthy community. Yesterday morning, do you remember when Dr. Levy said that we are often too complacent in public health? Marge is not a complacent person. For 25 years, she has had her forefinger on the pulse of health in our community, and she diligently monitors on a regular basis, from TV surveillance to immunization, to dispensing the latest OVH updates, which are many and often, and she has helped with the continuing vision of optimum health in our community. She also makes the Amish population, our elderly, and the youth top priority. She never stops with new ideas. As my friend and my mentor of public health nursing, she has contributed personally to my own growth as a public health nurse, giving me the same respect for public health nursing that she has. It was my privilege to nominate Marge for this award, and I wish to thank those who felt she did deserve and was very worthy of being named Ohio Public Health Association 1996 Outstanding Public Health Nurse.
Funeral. 25 years ago, I decided I was going to try public health. I was going to come into public health nursing for a year, give it a try. I got hooked 25 years later and still here. And you know, I still love public health after 25 years. I went to my first public health classes and I came back and told my supervisor if I did everything I should be doing in public health, I would be working 24 hours a day and 7 days a week. And I remember she smiled at me and said, if you ever get done, I'll fire you. And I've never been done. 25 years, we all know, everybody sitting here knows that there's no end to public health. Every day is another challenge, and every day is something I learn new, which is really discouraging to my nurses because I tell them I learn something new every day, and we do. OPHA has been a big part of my life. The professionals that I've met at the Ohio Public Health Association, we went home with ideas from our peers. I came to OPHA and talked about what went on in our department. They talked about what went on in theirs. And I came home with new ideas and everybody ran because they thought something new was going to happen in our office, and it usually did. I appreciate all those persons who have taught me and supported me in my public health practice. I thank the committee for choosing me. For those of us who have been so long in the business, we still find there is so much to do and so little time to do it. I want to thank Julia, my staff, my friends for this honor, and I want to leave you with some good advice that I've learned in the trenches, and I'll help take those trenches. Public health nursing is a series of unfunded mandates. Public health nursing is an HMO. If no one can pay, what can we say? Public health nursing is empowering the public to make a difference. The public says, why doesn't somebody do something about health problems? We at the health department search our hearts and find that we are.